Hello, my name is Brianni Jackson, and today we'll be discussing the Hope for Change initiative. As we all know, the health and well-being of individuals born across the nation are largely determined by characteristics such as race or ethnicity, religion, gender, mental health, and the overall social and economic environment of the individual's upbringing. Minority populations identified as African American, Latino, Asian, or Pacific Islander constitute approximately 30% of the U.S. population and are among the fastest growing populations in the country. Health disparities impacting these minority groups include lower life expectancy, higher incidence of diabetes, and higher incidence of HIV and AIDS. Racial and ethnic disparities include access to insurance, receipt of quality of care, and health outcomes, and are reflected in the nation's overall health care spending. Creating an environment that promotes healthy behaviors to promote and control chronic diseases and their risk factors requires renewed commitment to prevention, with an emphasis on strengthening community-based approaches to reduce high-risk behaviors. In 2008, 17.2% of working adults between the ages of 18 and 64 lacked health insurance coverage. Of that 17.2%, African Americans, American Indians, Alaska Natives, Latinos, Asians, and Pacific Islanders accounted for 54% of the uninsured population in the U.S. Unfortunately, Fresno County residents are among the population impacted by these health disparities. In 2010, nearly 250,000 Fresno County residents lived in poverty. The poverty rate among school-aged children in Fresno County jumped from 27.1% in 2007 to 36.2% in 2010. This also represented the highest percentage of school-aged children living in poverty in the state of California. The Hope for Change initiative will use a community-based approach to reduce health disparities in Fresno County residents. This initiative will strive to achieve health equality by developing partnerships with county residents, policymakers, local business owners, corporations, and community leaders. The goal is to empower Fresno County residents to improve the health of their community, seek better healthcare services, change local healthcare policies, and support the community by implementing programs that address their unique social, historical, economic, and cultural circumstances. The initiative will bring stakeholders together to develop and implement an action plan that will effectively address health disparities seen in the minority populations of Fresno County. The Hope for Change initiative will commit to consistently assessing the impact of all health-related policies and programs that impact racial and ethnic health disparities. To assess the current realities and trends, primary data will be collected by the initiative's action team and coordinating committee. The data will be collected by engaging community members and will employ methods that include focus groups, public meetings, and surveys. The community members will be asked to engage in discussions about their personal health and their perspective of the health of their community. They will also be asked to describe limitations and barriers as well as offer solutions that they feel may be appropriate for their specific population. When it comes to the action planning phase of the Hope for Change initiative, the overall goal is to increase the availability and the quality of health care for minority populations in Fresno County. The objective is to reduce health disparities in these populations by increasing availability and effectiveness of community-based programs and policies. In order to ensure success in this initiative, the action team and coordinating committee will work with local, state, and federal agencies to implement strong surveillance systems that promote positive and improving trends among these populations, as well as monitor health outcomes and quality of care. The initiative's action team and coordinating committee will also work with policymakers to help ensure that data collection standards for race or ethnicity, gender, mental health, and disability status are supported and implemented. Partnerships with local, state, and federal agencies will allow the following action items to be implemented. First, the initiative will work with the community members to build their capacity for implementing evidence-based policies. With funding from the CDC Community Transformation Grants Program, the Hope for Change initiative will implement, evaluate, and disseminate community preventative health activities. The goal is to reduce chronic disease rates, prevent the development of secondary conditions, address health disparities, and develop a stronger evidence base for effective prevention programming. Second, the Hope for Change initiative will work with West Fresno County residents to implement an education and outreach campaign regarding the benefits of prevention. The campaign will reach racial and ethnic minority populations residing in West Fresno and communicate the importance of accessing preventative services related to nutrition, physical activity, and tobacco use, to name a few. Third, the Hope for Change initiative will encourage policymakers to adopt a health-focused approach when developing and managing policies in Fresno County. This approach will address health disparities by encouraging federal departments, the private sector, and community-based organizations to adopt a health in all policies approach for assessing community-based policies and program decision-making. As a result of the implementation of these action items, it is expected that stakeholders in funded communities will work to reduce the higher incident rate of heart attacks, cancers, and strokes in minority populations by addressing a broad range of risk factors and conditions, including poor nutrition and physical inactivity. The action items of the Hope for Change initiative will be monitored and evaluated on a biannual basis. Every 6 months, the action team, coordinating committee, and community stakeholders will review and report the progression to the community residents. Regular reviews of progress will determine whether or not the goals are being met and if any of the strategies need to be refined. Local health departments and state agencies will work together to conduct health impact assessments on policies and programs proposed by this initiative. Health disparity impact assessments can be a great way to monitor the initiative's action items. It can allow policymakers to have a better understanding of what's working and what's not working when it comes to the implementation and the success of policies and programs through this initiative. If progress is not being made, strategies can be adjusted to better fit the social and economic environment that may have changed at that time as well.